Tympanoplasty. Introduction. Please point to the eardrum. Choose one of the following options. Correct. The eardrum is a thin layer of tissue deep inside the ear. It is oval-shaped. Middle ear infections, injury, and very loud noises can cause an eardrum to rupture. Select true or false. Correct. Bloody drainage from the ear may be an indication that the eardrum has ruptured. Select true or false. Correct. But not everybody that has a perforated eardrum sees bloody drainage. A ruptured eardrum can cause frequent ear infections. Select true or false. Correct. Ruptured eardrums are caused by ear infections. When an eardrum ruptures, it causes more ear infections because water infected with bacteria could get through the hole to the inner ear. An eardrum infection could heal on its own. Select true or false. Correct. If the hole or tear is small, the eardrum may heal on its own. Which one of the following is an advantage of tympanoplasty? Choose one of the following options. 1. Improve hearing. 2. Prevent frequent infections. 3. Reduce tinnitus. 4. Prevent cholesteatoma. 5. All of the above. Correct. Risks of anesthesia include developing a serious allergic reaction to the anesthetic drug. Select true or false. Correct. There is a risk of developing an allergic reaction to the anesthetic drug. However, this is rare. You should tell your doctor about any allergy to medications or other substances you are aware of. The risk of bleeding is common during this procedure. Select true or false. Correct. The risk of bleeding is rare. The chances of repairing a perforated eardrum are high after a tympanoplasty. Select true or false. Correct. Tympanoplasty is usually successful at repairing eardrum perforations. Following the post-surgery self-care instructions is critical for the success of this surgery. Thank you for using Explain.